Hello, I am Dr. Beena Muktesh, Director, Silverleaf Fertility Center, Gurgaon. Today we are going to talk about Azoospermia. Azoospermia means no sperms in the semen. If a patient is getting the report of azoospermia or no sperms in the semen, it doesn't mean that patient is sterile or cannot produce a child. With the help of latest technology, IVF ICSI, it is possible to retrieve sperms from the testes and get the pregnancy. Let's see what are the causes of azoospermia. Mainly there are three main reasons. Either there could be blockage in the tract which carries the sperm, or there will be no sperm production in the testes, or because of the hormonal problem the sperm production may be suppressed. Now let's see what are the causes of obstruction in the tract. There may be infection in the tract. It could be because of the mechanical obstruction, or it could be from very beginning, maybe from birth they have got some defect because of there may be obstruction in the tract. The reasons for no production of the sperm in the testes may be sometimes it is congenital because of the atrophy of the testes, or undescended testes. It could be because after birth testes should be in the scrotum. Sometimes testes are not able to come down to the scrotum, they stay in the abdomen only. In such cases we find azoospermia. Or there could be damage of testicular tissue because of radiotherapy or maybe chemotherapy, or sometimes there may be no cause at all. Patient is just having no production of sperm and there is no reason for it. Now let's see how can we treat these patients. There are two ways. Either patient should go for donor sperm, or patient sperm can be retrieved from the testes by a minor surgery. If patient is ready to get sperms from the bank, they are called sperm donor banks, then patient can become pregnant because these are the good sperms. Most of the time people have got doubt in the mind, I don't know from where the sperms must have been procured. It may be from some illiterate person, some poor person, some diseased person, or maybe many more doubts come to your mind. Let me clarify this. If the sample is taken from the bank, semen bank, which are authorized banks, they have got records of the patient. So they test the patient for all diseases like HIV, hepatitis B, hepatitis C, and other venereal diseases. Second is these samples are washed with culture media and stored, or they can be washed later on while doing IUI. Moreover, you can ask them to match the donor with the recipient or the patient in the form of complexion, height, weight, education, color of the eyes and blood group as well. All these things can be matched and a bank can be asked to provide a sample which resembles the husband. Like that, if such samples are obtained, that case IUI can be done and patient can become pregnant. It is important to do at least 3 times IUIs so that 90% chances are there that these patients will conceive. The second option for treating such patient is to obtain sperms directly from the testes. It can be done with the help of a needle or minor surgical procedure under general anesthesia or maybe local anesthesia. Many times it is not possible to obtain sperms like that because the whole testis doesn't produce sperms. A localized area, a small area in the testes produces sperms. So an advanced technique is used in which the operating microscope is used to localize that area which is producing the sperm, and like this we obtain sperm from that area which is producing sperms. One should be very clear that sperms obtained from the testes cannot be used for IUI or maybe for natural conception. It has to be IVF and ICSI only. So, to conclude, even if the people who are not able to produce sperms in the semen can become biological father of a child. So, we should not call anybody sterile until and unless all efforts are made to help these couple. Thank you. Thank you very much.